Hello, my name is Zara. I'm a student physical therapy assistant at CBD College. So today I will present a metabolic peripheral polyneuropathy. So in our agenda, we have the introduction, risk factor which is modifiable, non-modifiable, the treatment, and our conclusion. So before we started, let's answer this question. What do you think is the common cause of peripheral neuropathy in patients with diabetes, and how does it affect their daily function? So metabolic peripheral polyneuropathy, or MPN, it's a nerve damage caused by metabolic disorder, which is commonly known as diabetes. So in how to address is in physical therapy in order to enhance the care to the patient. Evidence practice is very important for managing condition, ensuring that we provide helpful, scientifically supported treatments. So today our goals for this session is educate physical therapy assistant or PTA on the risk factors and the treatments consideration for MPN or metabolic polyneuropathy. So non-modifiable risk factors, number one is the age. Older adults can have a higher risk of developing MPN due to the natural aging process and cumulative exposure of the risk factors. And then number two is the genetic factors. So which is if you have family history of diabetes or other metabolic disorders, can increase the susceptibility that you might have the diabetes or metabolic disorder. And inherited conditions such as Charcot-Marie-Tooth disease can also play a role as a nerve damage. So number three is the gender. Some studies suggested that males may be more prone to certain types of metabolic neuropathy, especially diabetic neuropathy. So, modifiable risk factors, number one is diabetes mellitus. So, uncontrolled diabetes, especially when your glucose is high level and poor management, is the most significant risk factor for metabolic peripheral polyneuropathy. So, prolonged hyperglycemia within the nerves fiber, inflammation, and metabolic disturbance with the nerve fibers. So the evidence for this one is study shows how proper glycemic control can significantly reduce the risk neuropathy progression, and a study by Pellman at EL 2019 demonstrated that maintaining A1C levels below 7% can help prevent and slow the progression of diabetic neuropathy. And number two is the alcohol consumption. So chronic alcohol use can lead to nutritional deficiency, which especially B vitamins, and direct toxic effect to the nerves, increasing the risk of neuropathy. So the evidence highlights that reducing of eliminating alcohol consumption can improve symptoms of neuropathy and prevent further damage for McDonald ATAL 2020. So vitamin deficiencies or deficiencies, it's the deficiencies of in vitamin B, it's particular B12, can lead to peripheral nerve damage. Nutritional support is critical preventing or managing MPN. So evidence-based to the clinic guidelines support that treatments of vitamin B12 deficiencies as a part of neuropathy management, emphasizing its role in the nerve health. So the last one is the obesity. So obesity contribute to the development of insulin resistance, which is in turn increase the risk of diabetic neuropathy. So evidence-based its weight management and dietary condition such as increased fiber intake have been shown to reduce the incidence of neuropathy in overweight patients. So for physical therapy treatment consideration, physical therapy can play an important role in managing NPN by addressing physical impairments and functional limitation caused by nerve damage. So it's crucial to apply evidence-based practice when designing a treatment plan to help manage symptoms, improve function, and prevent further complication. So goals as a therapy. So number one is a pain management, which is the primary goals is to to reduce the pain associated with the nerve damagement. So neuropathic is often described as burning, stabbing, or tingling, and can significantly affect a patient quality of life. So number two, it's improvement, function, and mobility, which is as a nerve damage can lead it into weakness, poor coordination, and a balance deficits. A physical therapy intervention to help to improve strength, flexibility, and gait to restore and maintain functional independence. So prevention of secondary complication is neuropathy, increase the risk falls and injuries, and physical therapy help to minimize the risk by improving balance and proprioception. So the last one is a patient education. This is important because education patient how to manage their metabolic conditions such as maintaining healthy food, healthy blood sugar, high fiber, or addressing alcohol consumption is a critical part of a physical therapy role in managing of MPN. So for the evidence based on physical therapy intervention, which is strengthening exercises. So the evidence study by Kornblatt et al. 2020 showed that progressive strength training could help muscle atrophy and improve functional outcomes in patients with diabetic neuropathy. So targeted exercises can help maintain or improve muscle strength, particularly in a lower limb, whereas in weakness in common in MPN. So this includes exercises focused on the ankle, foot, legs, muscle to improve gait and function. So number two, it's the balance and coordination training, which is evidence research by Alvarado et al. 2021 that found that balance training significantly reduced fall risk and improved quality of life if the patient have the diabetic neuropathy, which is because of the NPN can affect the proprioception and coordination. Intervention focusing on balance is example of standing on one leg or tandem balance or use a balance board are essential to prevent falls. So number three, using stents, which is the modality by evidence systematic review suggested that stents can be affected reducing pain associated with neuropathies, especially diabetic patient, by Sue et al. 2018. So this modality can be effective in managing neuropathic pain. It works by stimulating sensory nerves to reduce pain and perception. And the last, not the last one, but the other one is stretching and range of motion exercises. So by evidence, stretching has been shown to improve joint mobility and reduce stiffness in the patient with diabetic neuropathy, which evidenced by Bello et al. 2019. So regular stretching exercise can help the patient to reduce muscle tightness and maintaining the flexibility. This is essential important preventing joint deformities and contractures, which are common in patients with long-standing neuropathy. And so there's one last one. It's a patient pain management strategies, which is modalities and manual therapy. So in addition to TENS, other modalities like heat pad, cold therapy may help to reduce discomfort associated with MPN. So the manual therapy techniques like massage or joint mobilization can provide short-term relief from pain, improve circulation, which may support nerve health. So our conclusion for this agenda or for this session or this presentation is the NPN, which is metabolic peripheral polyneuropathy, is a complex condition with multiple risk factors, which is many of our modifiable through lifestyle changes, medication management, and physical therapy intervention. As a physical therapy assistant, our role is to support patient in managing these risk factors, addressing impairments caused by this condition, and preventing further complication. So, by evidence-based practice should guide our approach to treatment, ensuring we use most effective intervention for improving patient outcomes by focusing on by focusing to pain management, functional improvement, and education. We can help the patient with MPN maintain their quality life of mobility. Thank you for listening. Hope this presentation helped to other student physical therapy assistant. I know this is not that so great presentation, but hopefully you learn a little bit from my presentation. Thank you so much.